Hello, everyone. I'm Lavanya Gupta, National Officer of Marketing and Sponsorship for AMSA India. And I'm delighted to invite Dr. Abdullah Ashraf on today's episode of the Medico podcast. Dr. Ashraf, better known as Ashrafology, is an eminent medical influencer on Instagram as well as YouTube. He is currently working as a house officer or intern at Alama Iqbal Medical College in Lahore. Dr. Ashraf is a gold medalist and he has some insightful tips to help keep a healthy work-life balance as both a doc and a influencer. So we welcome you.
Thank you so much. That was a very lovely introduction.
So it's a pleasure to have you on the show today.
It's a pleasure being here. I never thought that I would be, a spokesfigure for other medical students as well. So it's definitely an honor.
Yes, sir. Okay, so let's begin with talking about your journey through MBBS. How was it?
Like all other journeys through MBBS, my journey through MBBS was also it had its ups, it had its lows. So basically, I started off as a very confused medical student. I didn't know what goes where. Anatomy, physiology, biochemistry, they were just flying over my head. And the way we study in med school is very different from where we study in terms of before we get to med school, before the entrance test and all that. And basically, it was definitely a learning process. That is how I could, sum it up.
Okay, so what were your favorite subjects through medical school?
Okay, my favorite subjects. That would definitely be pharmacology and pathology and medicine. I love these three subjects. They were my favorite.
Yes, I completely agree with you. Very interesting subjects indeed. Mm-hmm. So what motivated you to be a medical influencer on Instagram and YouTube?
Okay, so that is I wasn't expecting for a great response, to be honest. I just did it because I'm a very socially anxious kind of person. Although I can hold a conversation very well, but inside, the social anxiety is crippling me. So that's why I did it, basically, to overcome my fears of publicly speaking and, talking to other people without getting anxious and nervous and thinking, oh, what are they thinking about me? Have I spoken too much? Have I spoken too little? All those little overthinkings that we do that ruin our day.
Yes.
So I did it it was kind of like a personal journey for me, not because I wanted to be an influencer or anything like that.
Okay, but you ended up becoming so popular indeed.
Yeah, I did. I'm so glad I resonated with so many other medicos on the internet. It definitely feels like, okay, I'm doing something right.
Yes, sir. So how were you able to overcome the awkwardness that you felt with public speaking?
Oh God, I'm still awkward to this day. Like when I upload something, I keep on checking it to see if it's any good or not. And sometimes you wouldn't know if this happens, but sometimes if I feel like it's really awkward or it's cringe, I go and delete it because I am like that fear. It's gotten a lot better. I don't do that anymore. But in my initial days, I was like, what did I just do? And then I would delete the post and no one would ever know. But the fear of public speaking, I can definitely say one thing, that once you start doing it, it gets better. It's something that you can't, if you have it, you can't kind of eliminate by avoiding it. You have to face it if you want to overcome it.
I feel a lot of medicos will resonate with you on this point because we're coming from a background where everybody has just been studying and not much interaction. So this will definitely help them. So what is your favorite hobbies or pastimes? How do you pass your time apart from studying?
So my favorite pastimes. Well, I was very kind of on the larger kind of side of the weight spectrum. So I started dabbling into fitness and bodybuilding in like first or second year, and I loved it. It was such it more so than exercising. It was such a big stress relief. It was literally the dose of endorphins I needed in the day. And whenever I felt like, oh God, my mind is just going to explode from all the anatomy that I did, I would just go to the gym. And my angers, my frustrations, they would be taken out on those bars of metal. And so basically, I do like to go to the gym a lot. Um, Other than that, what do I do? I like to video edit. I love video editing. So that is kind of why I thought social media was for me, because I like to edit videos. It's like something that I've done since the first year of my medical college.
Mhm. Right. So how did you teach yourself video editing?
So basically, a lot of YouTube, a lot of YouTube. I don't think there's any Premiere Pro video that I didn't watch back in 2018 or 19. I used to look at all those kind of videos. But obviously, when you transition to the mobile, you can't really use Premiere Pro as much as you would want to, because it's a very, it's a software heavy app. So you'd have to work around, mobile friendly apps. But basically, Peter McKinnon, he's a very, very big YouTuber, and I loved his videos. I would like literally spend 6-7 hours just look at bed, just looking at his videos.
That's amazing. Sir, apart from this, you have also been on top of your classes most of the time, and you're also a gold medalist. Can you tell us a little about your mindset and your strategies to reach to the top?
Okay, so I'm going to get a lot of hate for this, but I'm going to say I'm going to say something that every kind of, the nerd says. And that is that I didn't used to study at all when I was in the first or second years of my college. I basically, it took me 2 or 3 years. Basically, by the third year, it took me 3 years just to understand how to study for MBBS. Before that, I was a very mediocre, average Joe. That's how I would put it. So after the third year, I realized that, wait, I study so much and I'm not getting any results. I have to change up the strategy. Something is wrong. And then I realized one thing, which is I like scream, I shout it to every junior to this day. And that's that everything will not come in the paper. They are much more likely to test you on things that you will see on a daily basis, like asthma, as compared to a very rare disease. Okay. So I would read everything. And it's good that if you read everything. However, if you read everything, you don't know what's important and what's not important. And you don't know how much time should be given for uh, each kind of topic.
Right.
So in third year, I started kind of studying a little, what we refer to as study smartly. I would start doing that. And then drastically my scores improved. And I was like, okay. And then in fourth year, I kind of refined this a bit further. And in final year, what I would used to do is, and a lot of my seniors would do as well, I would categorize topics. Okay, this is a first priority topic. Okay, no matter what happens, I will have to read this before my exam. Then, for example, we have hypersensitivity pneumonitis. I would categorize that as a second priority topic. If I have time, I will memorize this before my exam. That's a second priority topic. And the third priority topic would be something very kind of, I don't know, a bronchogenic cyst. That I'm just shooting names here. That would be a third priority topic. That if I have the time, I'll read through it. I won't memorize it. I'll just read through it. So that is basically categorization of topics within a subject is how you can, everyone asks me, how did you manage to read the big books, Davidson and all these other, all the Harrison and stuff like that? How did you manage to do it? I would say I wouldn't read the book cover to cover. I look, they've told you through your past papers, past university questions, that we will be testing these topics. They aren't really going to deviate from the norm here. So if you just read one topic from a huge book, it's not covering the whole book, but you've read that big book. That's how I covered the big book. So basically, to sum it up, because I've been on a very long rant here, to sum it up, categorization of what's important versus what's not important. That's how I would sum it up.
Okay, sir. And sir, how would you what are your productivity tips? As how did you manage both the influencer life and making videos with your studies?
Okay, that is definitely a challenge, and I'm still struggling with it on a weekly basis. Before it was like a daily basis that I would forget to post videos and stuff like that. So productivity would be my number one productivity tip would be, I don't know if you guys know, there's an app called Anki. Okay. It's for spaced repetition, basically. So from third year, I started using it, and I haven't opened a single book since third year. Everything I need to know is in Anki. I don't open books anymore. I just download. There are so many resources on the internet. People have already made decks of your favorite books. You just have to go and search for them. I would use Anki, and basically that's a spaced repetition app. So it will show you that information again and again and again until you memorize it. So number one productivity tip would be Anki. Basically, it looks like you're on your phone 24/7, but you're actually studying. Second productivity tip would be that definitely engage in something healthy, like exercise, something like going to the gym, taking a walk even, because we don't realize how drastic that effect has on us. Like even after doing a topic, I would always take a 5-minute walk. And then another productivity tip would be it's called, I don't remember what it was called. Yeah. It's called priming. Priming is basically like when they tell you that Dr. XYZ has a lecture on this tomorrow. So they tell you, so the topper students of the class, what they would do is they would read the topic beforehand, right? And when they would go to the class, they're answering questions, they're enjoying the lecture. Have you guys ever wondered why they're doing that? Because I didn't used to do it, by the way. I started doing it in final year. That is because this is called priming. Basically, you give a very kind of dirty read to a topic just to get the bare bones of that topic. And then when you go and understand it from a much higher level, it suddenly becomes so much more digestible, so much more easier to grasp. So whenever I would used to do a topic, for example, let's take asthma, I would watch a video on YouTube. Any video at all is fine. I would watch a video on YouTube and then I would go to my textbook. It was never straight jumping into the textbook. It was always video and then textbook. And that's pretty much, and how to, oh, sorry, the question. I'm sorry if I digressed a little bit. The question is, how did I manage my influencing and studies, basically? Well, I'm a very kind of, I think I would like to have OCD, but my family says that you don't have it. You gave it to yourself. So I would basically have days. Okay, so Tuesday, Wednesdays are content creation days. I would batch film a bunch of content, and after I've recorded 5 or 6 videos, I would release them in 2 or 3 day intervals. Okay. So that's how it's not like I do content creation every day. I don't. A lot of the influencers that you're seeing, a lot of the creators that you're seeing, they don't have time to create videos every single day, unless if it's a full-time content creation job. But if you're a doctor like me, then creating content every day is it's very difficult. So I would basically set out 2 or 3 days, batch record a bunch of videos, release them in 2 to 3 day intervals.
Right. That's a very efficient way of managing both the things. And these are some amazing productivity tips that you've given us. Priming is this is one of the first time I've heard of priming, and sounds very interesting, honestly.
Yeah.
Okay, so moving into the clinical aspect now. So how did your clinics shape your understanding of medicine?
Oh, that is such a good question. So basically, clinics are the most important thing in med school. Period. I'm not even going to. There's no room for argument here. Okay. I don't care if you're missing out on lectures. If you didn't take Professor XYZ's lecture, it's fine. You'll find it. You'll find it in some book.
Mhm.
But clinics, please do not miss out on clinics. It's the first time you're being exposed to a clinical environment where you're seeing how the patient is in real time. We've only read about patients in books. Okay.
Right.
So when we see that patient who comes uh, in our books, it's shortness of breath, right?
Hmm.
The patient could come in with something completely their own description of things,
Right.
like my mouth is closed. Okay, they could come up with something like that. So for one symptom, there's like 10 or 11 ways they can describe that symptom. Okay, clinics are so important because they basically, that interaction with the patient, it's really compromised. In Pakistan it is. I don't know about India much, but in Pakistan, patient doctor interaction is a little bit, it's a little tweaked to favor the doctor, in which the doctor is higher on the hierarchy and he can say whatever he wants and the patient will agree. And they're like, okay, you're right. But here in the United Kingdom, or even in the United States, the patients have a lot of autonomy in terms of what they say in treatment. So if you don't know how to talk to patients in your final year, then you won't know how to handle these patients or similar patients when you go to countries and abroad, because there the patients will have a lot more autonomy.
Right.
And it's basically a very good kind of phrase that I learned in final year. I read it somewhere on the internet, or I don't know where it was. It was like a poster or something. The eyes can't see what the mind doesn't know. So, and I used to kind of spin it around and be like that. If you've read about something but you haven't seen it, then you won't be able to grasp it either. Okay.
Right.
So it works both ways. So clinics are very good because they are like your, and you can make a lot of mistakes in clinics. No one is going to judge you. They know that you're here to learn. Don't ever be embarrassed to learn. That is what I would like to say to everyone. Don't ever be embarrassed to learn. We all learned ABC one day, and then we combined that ABC, and now we're reading tons and tons of textbooks. But don't ever be embarrassed to learn. No one should ever make you feel bad for learning something that you don't know.
Right. It's just a matter of time that we're eventually going to know all of the information.
Yeah, definitely.
Right. Okay. Sir, how was your relationship with your seniors and juniors and the other members in medical school?
Okay, so my relationship with seniors, it up to this day, it's amazing. I had one of the best senior batch in my college. I'm not even joking. They were so invested in our kind of emotional and educational and academic upbringing that they were not even seniors, they were more like friends. Even to this day, I can text them, uh, hello, I have a senior called Anfal. Hello, Anfal, I'm worried about this. Could you please tell me? Hello, Sana, I'm worried about this. Could you please tell me? And just I'm studying for CLAB 2 exam.
Right.
So I have a senior known as Ibtihaj, and whenever I'm feeling down, I call him up, and he feels he doesn't even think that it's an inconvenience to him that I'm coming up with 100 or 10,000 completely non-existent issues, and they would listen to each and every one of them, and they would help me go through it. Not even academically validate you, they also emotionally validate you that it's fine, it's perfectly normal to feel this way. So my relationship with seniors was amazing. With juniors, I have a fantastic relationship with my juniors, because not just because of the page, but my juniors were very supportive when I basically had 200 followers. They were very supportive. They would share everything, they would like everything, comment on everything. They would always say that you make the best content, you deserve more followers, you deserve more followers. And even to this day, they are one of the best batch of juniors I really have. With my classmates, it's a completely different hand. So it's completely opposite from the interaction with that I've had with my seniors and my juniors.
Mhm.
So I'm not going to say much, but it's very limited, my interaction with my classmates. I only have like one friend or best friend. His name is Faik, and that's literally it. I do not have any other friends. I know it sounds like I live a very sad, miserable, cry in your own room kind of life, but as you grow up, you realize that sometimes it's true, quality matters more than quantity. So definitely, uh, let's just leave it at that. Okay.
Okay, sir. So your relationship with other than your batchmate sounds wonderful, and I will totally relate with you. Sometimes the quality matters over quantity. So have you ever fallen prey to the toxic culture of medical school?
Okay. Yes, definitely. I'm still kind of, reeling from the toxic culture of med school. Uh, in the start of med school, when you're kind of admitted into medical college, you don't feel it that much
Mhm.
because you're new. That euphoria is there. You've just been admitted. You have all these new people to meet, all these new subjects to study. Everyone's calling everyone in your family. If you're the first doctor in your family, they're calling you, oh, doctor, doctor, doctor. That feeling just carries you throughout first year.
Mhm.
Then second year comes around and things start hitting a bit more. They're like, okay, something's off, but you don't know what's off.
Mhm.
And that by the second year, that that also passes. And by the third year, that is when people come out of their holes, out of their caves, and a lot of leg pulling goes on. A lot of rumors go on, a lot of backbiting goes on, that you eventually will fall prey to. It's not like a what if situation. You will definitely fall prey to it. But I realize that if I'm going to if I'm going to face it anyway, might as well put on a brave face. So I would ignore it, is what I would say. And I'm not saying that it didn't affect me. I would basically, on their face, I'm not showing anything. But when I'm back in my room, my roommate knows everything. He knows basically the ups and the lows. He even tells me that, why are you so sensitive at times? I'm like, it's not that much, but it's the microaggressions that build up into the macroaggressions. You see little kind of aggressions or kind of biases towards you, and no one else is noticing it, because it's you it's against. So um, definitely toxic culture is definitely there, especially during when your medical school is ending. As soon as your med school is ending, there's a rat race that's going on. Everyone is in that rat race, that I am going to XYZ country before you. I am doing my XYZ exam before you. And I'm going to do it quicker than you. And I'm going to be a consultant and I'm going to earn millions of dollars or pounds. Or You get the gist of it.
Right.
But basically, I know it's really hard to it's easier said than done, but please get yourself out of this rat race. Learn to go at your own pace. While I'm saying this, I'm a very anxious person, and this does affect me at times. But please, 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 the sooner you get out of this rat race, the better. It does nothing other than make you crippling, anxious person who can't even go through 6 hours of his day without thinking about the next 6 months of his future. So get out of this rat race, focus on your own pace, do your exams. You will eventually clear the exams. Has there ever been, I'm just going to address the all the medicos here. Has there ever been an exam that you eventually did not clear? Yeah, no. Eventually you clear your exams. The timing can differ, but you'll get through it. You always do.
Right. And the medical journey is so long, time barely matters right now.
Yeah.
Okay, sir. Moving on to, okay, so what are your thoughts on studying medicine abroad in places like US, UK, or Ireland?
Okay. Yeah. Okay. So basically, over the past 2 or 3 years, what has happened is a lot of doctors are moving out of their home country. It's understandable. Look, in Pakistan and India, doctors are not incentivized enough to stay in their home country. Maybe in India it's a little bit better, but in Pakistan the medical system is just in shambles currently, in terms of academic progress. Our training is very good. We have a lot of it's a very practical hands-on based approach. But for a person who has two babies at home, they're also not just worried about their training, they're worried about making ends meet as well. So the government hasn't incentivized us enough to stay even. So unless you do that, no one's going to stay in the home country. In terms of UK, US, Ireland, definitely make your mind up as soon as possible. Okay. I still get confused at times. Why didn't I choose this over this or this over that? But take a decision, go through it through its entirety. Okay. Like, I'm going to go through the UK pathway. I'm just going to go through it, not looking at any other pathways. Once I'm done with this pathway, I'll consider other pathways. But it's definitely a good option. For the UK, you'd have to give the UK MLA or the PLAB. It was formerly called as PLAB. You'll have to give the UK MLA. For the US, you'll have to give the US MLE. And for Ireland, it's if you've done your intern year, you can apply for registration in Ireland with just your intern year alone. Given that you've done there are a specific set of rotations that you have to do for Ireland. But definitely, if you're considering it, consider it early. Don't wait till the last year to do it. If it's the third year, just think, okay, I like this pathway. I could consider doing it. So I'm going to work towards it. And in terms of money, the United States is a very good option. But someone who I'm not, there has been back to the toxic culture here. But everyone who's doing the US MLE will tell everyone that US is the best. It has the best lifestyle, best pay, best teaching, blah, blah, blah. I would like to break everyone's bubble here. Every healthcare system in the world is flawed. It's flawed to a certain degree. US is a good option, not because it's not flawed, but because it has a very less number of faults in their system. It's still flawed. It's $200 for an epinephrine, for an adrenaline injection in anaphylaxis. So basically, if you have an allergy, you're going to die without insurance. Okay. For someone for doctors, they don't consider this. But for someone, for example, if your significant other is not a doctor, they are someone who takes their healthcare system who takes their health seriously. If you, God forbid, you see your relative or child or significant other, you'd have to pay lots and lots of health insurance to make sure that she gets that injection. I'm just putting an example out here. For the UK pathway, it's really good. They have a government-run healthcare system. However, it's also flawed. Back to the argument, every healthcare system is flawed. So the UK healthcare system, it does provide a lot of free medical facilities. However, it's clogged up. There's a lot of backlog over here, and the patients aren't being seen by the doctors until 6 months or 5 months, depending. And the pay scale is not that much in terms of US. Okay, so basically the residents are paid the same, but when you become a consultant in the US versus once you become a consultant in the UK, the pay scale varies drastically. Ireland is a very good option. Great pay, great atmosphere. However, again, back to the flawed. Its training is not really good. Ireland is not really known for its training. So learn to take things with a bit of pinch of salt. Realize that what you're doing is not perfect. There are going to be advantages, disadvantages. Choose what suits you, not what suits others. Okay, that is something that I see medicos doing. What they do is basically, my friend is doing this, I'm going to do this as well, without ever looking about what they want from their life. Maybe if they want to go into surgery, US is not for them because US will not offer you surgery.
Right.
So stuff like that. All really good options, by the way. But I read a post somewhere. I read a lot of posts because obviously I'm on Instagram 24/7. But the crux of that was that if you're not happy where you currently are, then move out. Okay. So if someone asks you, why do you want to go to the UK/US/Ireland? I'm just not happy with where I currently am. If you're not happy with where you currently are, you can move.
Right. Okay. So there is a lot of competition even for PG and UG. So what do you think are some of the other pathways that medical students can pursue after undergraduation if they're not pursuing post-graduation?
Okay, so that's basically it falls into that kind of same argument of UK, US, and Ireland. But one more thing, there's another fourth pathway, and that pathway is something that I'm doing right now, and that's called being a content creator. Do it, definitely. I think every medical student has the capability of doing so. You just have to bring the confidence over there. For if you don't want to pursue PG-ship in your home country, it's completely fine. NEET PG is a very difficult exam from what I've heard. Basically, I just heard that one day before the exam, they cancelled the exam, right? Something like that, right?
Yes, sir.
That's just not nice to do to students, especially students who've prepared a lot for this exam.
Right.
But NEET PG has its own disadvantages. While I was studying for the PLAB exam, I had actually a very good friend of mine. He had done his NEET PG, and I think you guys have ranks or something like that. Okay,
yes.
So he had a very good rank as well. But he was like, I'm not happy with India's current healthcare system, and I want to go to the UK. I'm like, fine, dude, you do you. And so after, if you don't do PG-ship, what you could do is take a break. First of all, guys, breaks are fine. They're not bad. Say it with me. Breaks are not bad. Okay.
Right.
Take a break. Reevaluate your life. Complete your intern year. Please complete your intern year. And think about where you want to go. You have a lot of options. You have the UK MLA PLAB option, which is really good if you want to go to Australia as well, because it's kind of like it transfers over there. If you've done the UK MLA PLAB, you can go to Australia as well. You can apply for the medical license. So it's good if you want to go to Australia as well. You have the Ireland, the IMC, Irish Medical Council. You just need to take a look. I did a reel on it on the Irish Medical Council on how to apply for it. It's still on my page if anyone wants to check it out. Basically, you have to have a specific set number of rotations. It has to be medicine, surgery, and specific rotations that they acknowledge. And if you haven't done those rotations, then obviously you'll have to do them an internship of 3 or more months again of those rotations. Um, uh, and once you've done them, you can apply for the registration process. It's a long process. It takes like 3 to 4 months. The registration process is long. The work isn't a lot, but they take a lot of time responding and getting back to you. So Ireland is definitely an option. Ireland is definitely an interim option. I would call that an interim option, because if you applied for the Irish Medical Council, you're earning lots of money and you're basically settled. Okay. So you're basically able to bankroll yourself for the UK or US pathway. That okay, now my financial constraints are gone. I can fund myself for the UK or US pathway. Okay, this is for people who are finding it difficult to pay for the exams are very expensive. So if you're finding difficult to pay for all the exams, and some of us might have families, we have to take care of them as well. So Ireland is a good intermediate option. I for Ireland, I for intermediate. Okay. And the US, it's step 1, step 2 CK, and step 3. Now the competition is a lot in US, especially we will see in the upcoming years. Since US Assembly step 1 has converted from a score to a pass fail exam, it won't be reflected within. It wasn't reflected last year. It might not be reflected this year, but in the coming years, there is going to be a lot of competition for the US. And if you're going to the US, you have to be prepared. You have to have like $9,000-10,000 set aside, that if I don't match in the first cycle, I'm going to pay for the next cycle. And if I don't match there, basically, US is a all or none approach. You're risking it all to go to US. Okay. But please don't burn all your bridges. Okay. Because you need to do the intern year. In case you don't match into US, you can come back to your home country, do something, do an internship, do anything at all, so that you can make at least you can carry your own self. Or like I said, go to Ireland, again study, again wait for the next match cycle, apply again. Okay. So US is a very kind of risky approach if you're not doing anything else, if you're not doing intern year, if you're not applying for any postgraduate exam. It's a little risky, but the payoff is good. You get to be a doctor in the US. The training years are comparatively less. It's a very fast-paced environment. So they have doubled the number of work hours, and so the residency years are cut by half. Okay. So it's 3 years.
Okay. So you're suggesting,
or for internal medicine. Yeah.
Right. So you're suggesting preferring Ireland as an interim and then proceeding to any of the other countries like US, UK.
Yeah. That is definitely a very good option.
Right. Okay, sir. Okay. So moving on, with the ever increasing demands from the junior doctors, how do you think medical schools should adapt their training programs to better prepare the junior doctors for the future?
Okay. Yes. Very good question. So basically, I feel, and you might have felt it as well, that our curriculums are kind of tailored towards the theoretical aspect of things.
Right.
Okay. And that's all they're really focused on. And when we see patients, but not really. Other healthcare systems like the UK, US, their students are in the hospital from day one. Okay. They're doing rounds with their consultants, not around like hospital very early on. What I would do if I would change the curriculum a little bit, that needs to happen, is basically we need to implement this kind of a similar approach. We need to be sending our students or the medical students into the hospitals from day one. Okay. And basically, for example, it doesn't have to, because I know the government hospitals are they're huge and they're always rushed. But we have to, this is our thing. So for anatomy, for example, let's just say anatomy. For first year or second year, the students could just go to the surgery department, take a look at surgical rounds, When pharmacology and medicine comes along, those 2 years should be dedicated to medicine rounds. So 2 years of surgery, 2 years of medicine rounds. Okay. And then obviously obs and gynae and peds when we take a look at the subjects. Okay. But basically hospital exposure should be your top priority. Even if you're not studying as much, it's fine. As long as you're seeing patients, you're going into the hospital. Okay. So that is something I would implement. Second, I would implement that practical skills. We really need to focus on practical skills, and there should be like a separate layout for this. So basically a separate subject for this, practical skills, which would include IV cannulation, taking samples, and intubations, and lumbar punctures. I did my anesthesia rotation in Pakistan, and it was one of the best rotations ever. We got to do intubations, spinals, lumbar punctures. It was amazing. And I was just thinking how happy medical students would be if they got to learn this, or they had this skill very early on as compared to later, as when I learned. And third, that I would definitely implement a basic life-saving course of any kind. We need to, should be like, we should know it. ALS should be everyone's priority, because anyone can collapse at any time. Hopefully that doesn't happen to you. And if that happens, you should know how to at least give compressions till the ambulance comes around and they can save them. So this is basically, I would change the curriculum so that it would be less theory based and more practical based. That's what I would, that's how I would want junior doctors to be trained.
So you would want more clinical.
Because theory you learn. Eventually you learn theory.
Right. So you'd want more clinical
exposure, definitely,
and hands-on activities. Right. Agreed, sir. Okay.
Yes.
So can you enumerate some of your lowest points while pursuing medicine? And how did you like recover from it, or what kept you motivated throughout the process?
Okay, my lowest points. Well, like I told you, I wasn't a very good medical student from the first year and second year. And because of that, I kind of missed out on honors or distinctions a lot. Okay. So I know this sounds very trivial, but for someone who's actually worked for it, they want it.
Right.
So I missed a lot of distinctions by like 1 mark or 2 marks even. People would just come to me and they would be like, they would rub it in my face that, no, you didn't get it. Oh, it's fine. Maybe I was always known in med school as the beggar of distinctions. Okay. So basically, when my viva was going really good, I would ask for the distinction. Okay. That I need, my theory was good. I had a great viva. I'm going to ask for the distinction.
Right.
And the teacher would give it. But I would miss when the total kind of combines, I would miss it by 1 mark. So I was known as that person. So constantly failing. I don't know if it sounds wrong, but when you work for something and you want something, but not getting it, it hurts. It definitely hurts.
Right.
So I stopped trying for distinctions and honors in third year and third year. And when I stopped doing that, would you believe it? In my fourth year, I got a distinction. I stopped trying. I stopped believing that I would ever get it. So that would, so from lesson 1, I would learn is that there are some things you can't change. That some things that will be rewarded to you only when it's time. Okay. You should study good. Please focus on your concepts. Don't go for rote memorization 24/7. We have a lot of rote memorization, but try to build concepts. They pay off later on.
Right.
But please realize that hard work doesn't go to waste. It comes back in so many ways. Like, for example, the distinction that I missed, it was pharmacology. I missed it by 1 mark. So, but if I didn't study pharmacology well, I wouldn't have gotten the medicine distinction and gold medal.
Right.
So second lowest point would for me was basically in med school. My health took a very like it took a turn for the worst, and people started commenting on how I look and how let's just not get into it a lot, but how bad I look. So that is something that first of all, please don't be so petty or so superficial that you comment on someone's looks and break their self-esteem. Don't ever do that.
Right.
So that is when I basically started going into the gym and exercising and eating well. But I shouldn't have done that to please that person or please the people who were calling me those names. So that is definitely the moral of the story is that please don't take whatever toxic students throw your way.
Right.
If they're saying something, please learn to ignore. If you know how to ignore in this political climate of the world, you're golden. You'll succeed. Don't worry about that. Learn to ignore. Ignoring is a very, very powerful skill. And lastly, third would be a lowest point that I faced like 2 years or 1 year ago, and that is the whole rat race ideology that I was so confused upon where to go.
Mhm.
I was so worried, and it got me. And I'm nowhere, and I'm not going anywhere, and I'm stuck, and I'm not going to go anywhere. But I believe me, everyone has those thoughts. But the sooner you realize that everyone has their own clock, and it beats at different times, and your 2 o'clock will come at a later date than someone else's 2 o'clock. Okay,
Yeah.
so just be content with yourself and learn to realize that good things take time. Okay.
Yeah. We just have to wait for it.
Yes, definitely.
So, who was the most significant part of your support system throughout this journey?
The most significant part of my support system would definitely be my mother and my sisters, Annie and Miru, and my best friend, Faik. These four people. My father actually he got sick in first year, so he couldn't really support me throughout that process.
Right.
But my mother definitely. I think everyone's mother is their supporting system, and they're scolding you. They're loving you the same, but you can always go to them.
Right.
So that is something that I would always. Oh, one more thing, please do not compromise on your family for the sake of your friends. I've done that. Please don't do it. It's not worth it, because your friends will go back to their families, and you've kind of you prioritize your friends over your family, but they're going back to their families. So please prioritize your family. Don't ever prioritize your friends over your family. Okay.
Right.
And my best friend Faik, he has been a support. He's like literally the opposite of me. Introvert, and doesn't say a lot. Gives a very he gives sentences that are very kind of hit you at times, like, okay, what did he just say, that kind of person. But he's very he's an extrovert with me.
Right.
So
He's comfortable with you. Right. Right.
yeah, he's comfortable with me.
That's very sweet to hear, sir. So, how has your profession as a doctor and an influencer changed your personality?
Oh yes. So as an influencer and as a doctor, uh, you, basically your personality doesn't change until you go to the hospital, and only if you want it to change. But this was during that low time in my life that I told you that I'm worried about the rat race and all that.
Mm-hmm.
And a patient came to us. She had SLE, and her eyes had basically dried out from the kind of cirrhosis that she had, and she had gone blind from the SLE and the cirrhosis. And I just looked at her and I was like that she didn't get any treatment. I was a little bit frustrated that why didn't she come to the hospital before? She could have seen someone. Maybe someone could have diagnosed her. She could have gotten steroids, something like that. So the house officer in charge, or the intern doctor in charge, told me that you should go make an analogous serum for her eyes. Basically, it's PRP but for the eyes. It involves filtering the blood out and dropping those eyes. It promotes epithelial healing. Okay, so obviously I'd have to take her to the eye clinic, to the hematology clinic to do that. So I took her, and it was such a sad moment for me, because for me, I've been thinking about all these exams that I have to give and all these things that I want to do with my life. And for this woman, all she wanted was, and I bet all she could ever want from life was to get her sight back or to see anything clearly for the first time again. And that really put things in perspective, that sometimes your problems aren't as big as you make them out to be in your head. So please learn to practice gratitude and appreciate what you have. It sounds so easy. I'm going to be this this preacher of gratitude and humility and believe in yourself. It sounds so easy to say it, but I know a lot of you will hear it and just leave it. But it really learned it to put things into perspective, because your problems, they're in your head and you've made them as big as you want. But just my advice would be, just take a look at someone else's problems sometimes, just to realize how good you have it sometimes. Okay. And as an influencer, it's changed my personality. If you met me 1 year ago, I wasn't this confident. I wasn't this extroverted. I wouldn't talk for hours and hours and hours. I do talk for hours and hours and hours, but that's with my best friend. But it's definitely made me a much more confident, much more outspoken person. That's what I would say.
That is great to hear. Medicine does teach you to be very grateful and thankful for what you have in your life. And yes, definitely, it has made you very confident, as we can see, sir. Okay. Sir, can you tell us something about your future goals or projects that you have in mind for medicine or any of your artistic talents that you have?
Okay, so currently I'm just focusing on passing my lab 2 exam. It's in a bit. There's time for that exam. It's going to take place in a few months. But other than the academic goals, after I cleared it, I'm just going to take a back seat for a bit and relax.
Yes, sir.
And then I'm going to focus on content creation a bit more. Right now, I don't upload so much videos. I really would want to upload more, but I just don't have time. I'm doing a clinical attachment here in the United Kingdom, so I don't have time with that. And then I have to come back, I have to study, go to the gym as well. Never miss out on the gym or exercise. That's literally the only room where you can breathe, and come back and sleep. So it's a very kind of hectic schedule right now. Once I clear my exams, I'm definitely going to be focusing more on content creation. I'm going to shift more towards YouTube, because people want a lot of messages that we want to hear your opinions on a lot of things, and we want you to talk more. But unfortunately, YouTube takes a lot of time. The video editing and the whole process, it takes a lot of time.
Right.
But definitely focusing more on YouTube after my exam is over. And then it's a very kind of, how you have a vision board and you want these things to happen. So my vision board, basically, I want to open a small non-profit organization, a charity. That's my goal. I want to do it, but it's only in my head. It's material wise, we're zero, but it's only in my head. And I want to open it, hopefully, when I get a few more, like at 100K followers, hopefully, I would want to open that uh, that organization, because it's something I feel deeply about. And that's pretty much it for the foreseeable future. That's it.
So what will be your goal with the organization that you're planning?
So the goal would be to basically, it's going to be made for students by students kind of thing.
Okay.
I haven't worked out the details yet, but it's basically going to fund students who aren't who are making it who are basically finding it difficult to get by in their day-to-day life. I want to incentivize students basically through that, and students who, not just medical students, I'm talking about all levels of education. If they're not getting their basic primary level education, they're not an their parents can't afford it or no one else can do it for them. I want to basically start with education, because my mother always told me that education can literally change your life, and I believe in that. I'm a firm believer of that. Education can change your life, so it can change someone else's life as well. So that is basically the framework I had in mind.
So that is very inspiring, and it's a great goal that you want to succeed in.
Let's just hope we achieve it.
Yes, sir, definitely. Sir, lastly, what is that one message or advice that you would like to give to your younger self who's just starting off medical school?
Mm, that's a very thought-provoking question. An advice I would give to my younger self. Okay, so don't be stupid. Don't be stupid. That is. If I could sum it up in one line, please do not be stupid, Abdullah. Yes,
Right.
that's how I would sum it up.
So very relevant to all of us in other aspects also.
Yes,
Um,
and one more. I would say calm down. Second would be calm down.
yes, sir, definitely. All of us are always in such a rush to
Yep,
proceed to things, to proceed to conclusions. Yes.
definitely.
So it has been a very inspiring session with you. Very great. Any last words
Thank you
for our
so much
listeners?
for having me. It was an honor. This is the first time I've ever done anything like this, so I'm glad. I hope you guys enjoyed it.
Yes, so we are very inspired right now, and we hope to see you on our platform once again.
Hopefully, I would love to. I would love to be there. Whenever you invite me again, I'm going to come running. Don't worry about it.
Thank you so much, sir. So it was such a
Oh,
pleasure to have you. Thank you, sir.
it was a pleasure being. Okay, take care now.
Thank you, sir. Goodbye.